anxiety. It is really important to differentiate between fear and anxiety. Fear is a normal emotion that's a response to a threat. For example, if we're out on the water and it's choppy with waves and stupidly say we don't have life jackets, it would be totally reasonable that my daughter has a fear of drowning. That's rational. One of the discussions now in my household is, you're anxious for a test. Great, you should be. That's normal. But what is not normal is when it gets in the way of living, or when it is irrational, that it stops you from doing what you should be doing and you're held back. So my daughter taught me that anxiety is a persistent worry that is not based on a real threat. What happened in our household 15 years ago was, if my daughter, say, skinned her knee a little bit, the whole world fell apart for her. It was an enormous, enormous response. And at the time, I was just frustrated and just, oh, she's got to toughen up. And, you know, we talk about this in our podcast together, that I did not give her the empathy that she needed. And in my mind, I was trying to help ground with a realistic response. And I didn't want things to get carried away with her immense reaction for small physical ailments. And as time went on, and now that she is older, I actually have seen an anxiety response to hurting herself or not feeling well, which has only developed for me to recognize this in the last few years. And by the way, I worked in the middle of this for almost 6 years at a psychiatric unit. But if I had maybe tuned in more to that, to have the notion and the acknowledgement that maybe this is more than just her being melodramatic, and that for her there is a deep, debilitating anxiety about being hurt, I probably could have responded a lot better with dialogue. How are you feeling? Let's talk about this. As well as just maybe having more empathy that my sweet girl needed.